Your child hits their head, they cry, and they seem okay. Do you watch them at home or do you rush to the emergency room? Do you wake them up during the night? Most head injuries in children are mild, but a small number are serious. In this video, I'll show you how doctors decide when to worry and when it's safe to breathe. Hi, I'm Dr. George Kampouroglou, pediatric surgeon. I evaluate children with head injuries in emergency settings every day, and I want to give parents a clear framework to make the right decision. This is the most important idea. A head injury is not the same as a brain injury. Most bumps cause pain and fear, but no damage to the brain. When doctors assess a child, we're not asking, did the head get hit? We're asking, is there any sign that the brain is being affected? Head injuries create anxiety because you can't see the brain, symptoms can appear later, and parents fear missing something important. That fear is normal. What helps is knowing which signs truly matter. Seek urgent medical care if you see any of the following: loss of consciousness, even briefly, repeated vomiting or vomiting that continues or starts later, severe or worsening headache, confusion, unusual behavior or trouble walking, seizures, problem with walking, balance or weakness, vision problems or unequal pupils, a child who is getting worse instead of better. These signs suggest the brain may be injured or bleeding could be developing. Sometimes symptoms aren't obvious right away. Medical evaluation is also important after high energy impacts like car or bike accidents, a hard blow from a heavy or fast moving object, a significant fall, any head injury in very young infants. In these cases, even a child who looks okay should be assessed. Now let's talk about what is often normal after a minor head injury. Immediate crying, a bump or swelling on the scalp, mild headache that improves, brief tiredness, acting shaken or clingy. If a child is alert, improving and behave normally, these signs alone are usually not dangerous. There are also specific physical signs that always require urgent medical attention. A skull fracture that you can feel as a depression in the bone. This is not a simple bump. It suggests the bone itself may be pushed inward. Clear fluid leaking from the nose or the ear. This can be cerebrospinal fluid and may indicate a fracture at the base of the skull. Bruising around the eyes, often called raccoon eyes, or bruising behind the ear. These are classic warning signs of a skull-base fracture, even if the injury happened hours earlier. In infants, a bulging or tense soft spot on the head, the anterior fontanelle. This can signal increased pressure inside the skull. These findings are uncommon, but when they are present, they are never normal and require urgent specialized evaluation and care. In general, if you have any doubts, contact your pediatrician or visit the emergency department. The question parents often ask, shouldn't we just do a CT scan to be sure? CT scans can detect fractures and bleeding, but they also expose children to radiation. That's why they are not routine. Doctors use the child's symptoms, the physical exams, and how things change over time. In low-risk situations, careful observation is safer than immediate imaging. Not doing a CT does not mean we are ignoring the injury. When doctors say we'll observe, we are watching for change. Improvement over time is reassuring. Worsening symptoms are not. That difference is key. If your child is safe to go home, keep them with you for the first several hours. Let them rest, watch for any new or worsening symptoms, keep activity calm for the rest of the day. But if anything concerns you, check them or seek care. Most childhood head injuries heal without complications. What protects children is not panic. It's parents who know the warning signs and act when needed. If you want a simple checklist for urgent situations, download my free ER quick guide for parents. Link is in the description below. I'm Dr. George Kampouroglou. Take care, see you in the next video.